Hi, everyone. Welcome back. Today we're joined by Travis Mickelson, Medical Director for Mental Health Integration here at Intermountain Healthcare. This is part 3 of our series on mental health awareness for the month of May. And today we're going to be discussing specifics around children and teenagers and what this means for them, especially right now. Travis, thank you so much for joining us. We really appreciate it.
It's nice to be back. You've been very busy this last month.
It's nice to see you again. We appreciate your time.
My pleasure.
So I know we've spoken a lot this month about resilience and reducing stigmas around mental health and really focusing on adults. We're more than a month into social distancing. It feels like 2 or 3 months at this point, and remote learning is wrapping up as well. What kind of emotions are kids going through at this current moment in time?
Well, I've had the luxury really of talking with many children and teenagers and parents over this last month, and I'm getting a big range of emotions. Talking to many teenagers who are feeling quite sad and frustrated and angry for some of the big events in their life that they're missing out on. Talking to many children who are feeling quite worried and anxious and scared about what this might mean, if they're going to get sick or get their grandparents sick, or if their parents are going to be able to find a new job, if they're going to have food and be able to stay in their home. But I'm also hearing great stories of children and teenagers that are talking about being quite happy and feeling relaxed and hopeful. I had a teenager last week who talked about how they're able to do their schoolwork really within just a few hours. It gives them more time to relax, and noticing that children and teenagers are playing outside more. And so I'm hearing the whole spectrum of emotions over this last month.
So some people call what you just described as emotional contagion, the phenomenon that emotions can be passed between people. So a child kind of growing off of what their parents are feeling. Can you pass anxiety to people around you? Is that a real thing?
Well, anxiety is a sense of fear and worry, and we're designed as humans, we're wired to pay attention to what's going on around us and be afraid or be worried if we think our safety might be at risk. And one of the best ways that we manage that fear and anxiety is with information that we get by making observations in our world, but as children, information that we get from our parents. And the other way that children get a sense of whether their environment, whether their place is safe, is by just looking at their parents. And they can tell by looking to their parents, they can tell if their parents are feeling worried or feeling frustrated themselves. And the families that seem to be doing best right now are families who have really developed a sense of structure, and they're providing these regular opportunities to be able to communicate with their children, to be able to give good information, also be able to listen to some of the concerns that their children and teenagers are having, but also having an opportunity for, as an adult, to be able to express to their children their emotions and being able to be role models as an adult for how to manage distress, how to calm ourselves down.
You mentioned before, too, a story about someone who has this calm down box. Can you explain a little bit about what that is?
Oh, yeah. So I think just a couple weeks ago, I was talking to an 8-year-old daughter, patient of mine, and she was able to tell me some of what she had learned from her parents and her therapist. And she was able to describe for me that emotions can be labeled green, yellow, or red. And she was able to give me an example of an emotion that would be labeled green, like feeling happy. Yellow would be something like feeling frustrated, and red would be something like feeling angry. And so what she was able to talk to me about was what she built was called a calm down box. And her parents went to the dollar store, and she was able to choose some little activities, some little devices that she could put into that calm down box. And she said, and she showed me this squishy ball. And the squishy ball was an example of something that she could pull out of her calm down box and squeeze. But what she told me, she said that it works best when my emotions are yellow. I said, what do you mean by that? And she said, well, when I get really angry, I seem to forget to use that calm down box. Or when my parents remind me, it just makes me more angry. But when I catch myself just feeling a little bit angry, like being frustrated, she noticed that these efforts, like using the calm down box, were actually more effective for her tolerating that level of emotion. And what she was also able to tell me is she said, when I notice myself when my emotions are in yellow, I find that I don't react in ways that get me in more trouble. And so she really acknowledged that when she can identify these emotions and find ways of managing before they get too big, she actually is more effective at having good behavior.
For an 8-year-old, that's very impressive.
It's incredible, isn't it?
Yeah, she sounds like she's very in tune with her emotions and has really great support from her parents as well. So that's great to hear. So not only are children that are younger getting affected, but teenagers are as well. We're wearing masks to the grocery store. We're not hanging out with our friends. We're staying 6 feet away from people. And we're not used to hearing about these shortages in supplies and these daily briefs that happen every day from our government and from the president. So teenagers are being really impacted by this. They're probably that group that sees this and are maybe a little bit confused as to what's going on. How does this anxiety in them happen, and what can they do to kind of keep it at bay?
That's a great question. I just think teenagers are the coolest people on the planet. They're really going through a monumental task right now of really developing a sense of who they are. That identity includes who their peer group is, and they're exploring and experimenting with things like style and fashion and gender and sexual orientation, and they're taking the values that they've learned from their parents and deciding what values they want to have for themselves. So it's just really an incredible time. But in order for teenagers to develop in this way, they really need to have access and be able to connect with their peer group. And so it's been really cool to see teenagers show a lot of creativity and ingenuity in how they're continuing to connect. I had a great example of a 16-year-old I talked to last week that she told me about this routine that she and a couple of her friends have every Monday afternoon, where they all drive their separate cars. They just happen to be 16, so they really like driving. So they all drive their separate cars to the local park. They have their blankets that they spread out that keeps them 6 feet apart, and they bring their own snacks. And so she really talked about all the efforts that they're making to be both safe, make sure that they're not contributing to spreading this virus, but also staying connected. And I think it's really great to see teenagers' creativity and finding ways of doing that. However, some teenagers really are struggling. I talked to another 17-year-old girl last week who told me that she was elected student body president. And she was really frustrated how there's just a lot of these ideas and goals she had for what she wanted to do for next year have kind of been hampered quite a bit since she's been forced to stay home and hasn't had as much of an opportunity to engage socially because her father has some chronic medical problems that put him at higher risk. One of the things that's quite clear to me now is teenagers really do appreciate the importance of being safe. They know what it means to flatten the curve, and I feel that they appreciate that they're really playing a role, and it makes them feel like this is something that's bigger than them. They're not just keeping themselves safe; they're keeping their parents safe. They're keeping society safe. So it's been really great for me to see and observe adolescents really showing a sense of emotional maturity in that way.
You mentioned them missing big events and them kind of realizing that they're so very much so involved with this. I watched something on YouTube the other day. It's called Some Good News, and they do segments all the time, and one of them was graduation for the 2020 class, and there was a bunch of high school and college students on there, and it was really cool to hear them talk because they realized what a big impact they could potentially have. They're entering this uncertainty. If you're graduating college, you're like, well, I was supposed to have a job. I might not anymore. And it was really interesting to hear them talk about what they're doing for themselves and how they're coping with everything going on. So I think teenagers and young adults are very adaptable to their future and have been great to listen to. So
That's right. We really are going to rely on them to help make things better in this world.
yes, they're the next generation.
Indeed.
Yeah. So back to children too. There's a lot of stuff that's going on, and we have to take a lot of steps in order to grow confidently in maybe something we're feeling anxious about, whether it's going to hang out with our friends or going to the grocery store. What are some ways we can build children up in uncertain times right now, where we ourselves might be struggling? So inviting them to come to the grocery store, I might feel unsafe there. How do I help them maybe not feel the way I do?
Yeah, that's a good question. Well, I think one thing that we can do as parents is really make sure, again, that we are role modeling, we are role modeling how to label our emotions. We're role modeling how to communicate to others how we're feeling. We're able to role model to our children how to cope with distress, doing mindfulness meditation or deep breathing exercises, how to role model to our kids when we've been grumpy or irritated with them, be able to go back to them and say, I'm sorry that I was so angry when I talked to you a few minutes ago. I'm just feeling frustrated with everything that's going on, and being able to apologize, really showing them that it's okay to have big emotions and communicate. But I think the other thing that's important to know is the way we influence behaviors in others is oftentimes parents will come to me and say, my children's misbehaving. Every time I ask my child to do something, they just have a fit. They just argue with me. And so they're wanting me to help them change that behavior. And one of the first things I ask them to do is I ask them to describe for me, what is the behavior that you want to see more of? And so they'll be able to say, I'd like my child to, when I ask them to do something, to be willing to do that without arguing. And maybe I'll give them only one warning, but I just don't want the arguing. And so one of the most powerful ways that we can influence others' behavior is by acknowledging when they're doing things the right way and providing them some acknowledgement and reward for those efforts. And the behavioral therapists tell us that we're supposed to acknowledge people doing the right thing 5 times as often as catching them and giving them a consequence for doing the negative thing. And that's about all I can do to you, Amanda, to change your behavior, is acknowledge you when you're acting the way that I'd like you to act. But what's even more important for children and teenagers is making them motivated to act in a certain way. And we're all more likely to behave in a certain way if we have a choice. So one of the common recommendations we give to parents is try to incorporate a sense of choice to your child. So like going back to the 8-year-old example, the parents gave that 8-year-old a choice into what she put into her calm down box. The other thing that's important is to help children experience a sense of mastery. We're more likely to do something if we feel good at it. Mm-hmm. So if I have a teenager who I know is working on coping strategies like mindfulness meditation, I'll ask them to teach me how you do that deep breathing exercise. And then that gives them a sense of mastery because of knowledge, because an adult is asking me to teach them how to do something. That's going to make them more likely to do that more in the future. And then lastly is just that overall feeling that we're in this together, that there's a broader sense of purpose. And this is what I'm seeing all around with teenagers, is that they're finding ways to creatively be social and playful, but at the same time acknowledging that the way they act can help keep themselves, their families, and society safe. So I think we need to think of both in terms of how we can reinforce someone else's behavior, but things that we can do to encourage them to be more motivated to act a certain way kind of on the inside.
You mentioned positive reinforcements a little bit throughout that, and encouraging them to be on their best behavior. What are some ways that we can use positive reinforcements to help with the mental well-being of a child, our child, or someone that we know as well? What are some more examples of that?
So let's see, let me think of another good example of this. So let me go back to a teenager that I talked with a couple of weeks ago, and she was dealing with some frustrations that she was having with her parents because she just felt like her parents were being a little bit too strict with allowing her to be social, to leave the house. And this was something that the teenager just acknowledged as this is something that's not really going to change. I think one of the things that she did when I talked to this teenager's mom, this mom told me, well, she cut her own hair. And I said, well, how did she respond to that? And the mom said, well, she doesn't have a big sense of control right now. So even though I can't stand her new haircut, I thought, hey, this is one thing that I can allow her to do to kind of give her a sense of control. And when I talked to the teenager and I said, hey, I like your haircut. And she said, yeah, it's a mullet. And the first thing she said is, my mom hates it. And I said, well, did your mom tell you that you couldn't cut it that way? And she said, no, she let me. And so I think that's, again, an example of helping children and teenagers to find ways they can have a sense of control, ways that they can do some things to make life better for them. Also, because they're also having to acknowledge a lot of things that they can't really change right now. Mm-hmm. And there's still a lot of uncertainty that they have looking forward into how long is this going to last? How much longer until I'm going to be able to be with my friends or go back to my soccer games? Or even that question about what is next school year going to look like? Am I going to be able to go to school next year? Am I going to have to do this online school thing for another year? So a lot of questions that teenagers and kids are having.
I like that example of her cutting her hair. Hair grows, so it's a good lesson for yourself to learn, and you do yourself and realize, hey, maybe next time I won't do this, but it's that control piece. She can control what she looks like, so I think that's great that parent was super supportive. And you bring up school for next year. It's crazy to think that might still be online, and I'm sure that parents are trying to figure out what that might mean if they're going into high school or even college students trying to figure that all out. So everything's evolving and changing as we learn more. But as a parent, I think it's great to be able to adapt to whatever the circumstances are. So Travis, do you have any other final thoughts on this topic specifically around children and teenagers and what they might be going through right now?
Yes, one of the last things I'd like to leave your viewers with is obviously there are many of us that are, even with all of the support and resources that we have, we're still really, really struggling. And one of the biggest concerns we have as professionals that work with teenagers, whether it's a teacher or a parent or a psychiatrist, is that our children are going to experience depression to the point where they're having thoughts of not wanting to be alive, wanting to hurt themselves in some way. And it's very important for children and teenagers and parents to know that there are a lot of resources out there. There's no one better than your pediatrician to touch base with, and maybe have that pediatrician have a conversation with your child or your teenager. Also, therapists and psychiatrists, we're all still able to see patients through video visits, and so there's just as much access to support as there always has been. And a couple other things that I want to just make sure that we all know about. The Uni Crisis Line and mobile outreach team is available to come to your home if you have any concern about suicide risk or self-harm risk. And also Intermountain has developed an emotional health relief hotline. So for those out there who are really struggling and needing some help navigating and finding some resources, our emotional health relief hotline is open from 10 a.m. to 10 p.m. 7 days a week. And the Uni Crisis Line is open 24/7. And then lastly, those people who are having thoughts of suicide, one of the greatest risks to them is that they will act on those thoughts. And the most common way of dying by suicide is by use of firearms. So if you or someone in your home is struggling with this right now, one of the best things you can do that will actually protect them is, number one, inquire about those thoughts. Talking about suicide is actually protective. And also, if you have firearms, make sure that they're secure during the time that you have that concern. That's one of the best ways that we can keep our family safe.
Yeah, I think talking to someone and just understanding what they're going through is a great reminder. I think everyone could use an extra hand right now, an extra ear to listen to them and just make sure that they're okay. So, Travis, thank you so much for joining us again.
Thank
we
you,
really
Amanda.
Appreciate it. That phone number, everyone, for you for the Emotional Health Relief Hotline is 833-442-2211. Like Travis said, it's available 7 days a week from 10 a.m. to 10 p.m. The Uni Crisis Hotline is also listed on the screen right now for you guys to reference as well. If you guys have any questions about COVID-19 related symptoms, you can also call our COVID-19 hotline at 844-442-5224. Thanks, everyone. We'll see you next time.